February, the county executive, David Crowley, he stood behind the podium. He asked community businesses and organizations to join our fight against the opioid crisis and to apply to host a harm reduction vending machine, like the one that's placed right behind me, right to the side of me. The harm reduction vending machines, they're stocked with free harm reduction supplies, including fentanyl test strips, nozzle naloxone, medication deactivation pouches, medication lock bags, and gun locks. Additionally, the vending machines now also carry a new fentanyl combination testing pack. We had nearly 30 organizations answer the call, and I'm so grateful to every one of them in the community and their commitment to our community and making sure we meet the needs of the community that we serve. Today, I have the privilege of announcing the 8 additional locations of the harm reduction vending machines throughout Milwaukee County. In addition to these 8 new vending machines, all the initial 11 locations will continue to host their vending machines, bringing the total number to 19 harm reduction vending machines in Milwaukee County. The addition of these new vending machines drastically increases the accessibility of life-saving supplies throughout the county. Most vending machines are now within 1 or 2 blocks of an MCTS bus route. And in 2023, 90% of Milwaukee County residents who experience an overdose live within a 10-minute drive of a harm reduction vending machine. And 1 in 5 of those residents are within a 10-minute walk. Removing barriers such as and destigmatizing our community, the use of these life-saving tools has an overwhelming positive impact on our community. Before I announce the new locations, I must take so Jennifer Whitmore, Jeremy Triblett, and our amazing team at the Department of Health and Human Services who are committed to making sure we meet the needs of the community that we serve. They recognize the community-wide impact that opioid crisis has on our residents and responded by developing innovative, evidence-based, data-driven initiatives and strategically investing opioid settlement funds. And their impact doesn't stop at the nearly 24 harm reduction vending machines they have placed. They have also launched a new community engagement effort to hand out harm reduction supplies in person in the area with greatest needs. And the Better Ways to Cope campaign promotes services, regrants funds to community-based organizations, and shares resources with community members. By taking a multi-pronged approach to harm reduction, we are able to positively impact more people and to save more lives. So I would like to thank our amazing team and the hard work and their commitment to Milwaukee County community. Now, without further ado, I want to announce the locations for our new harm reduction vending machines. 4th Dimension Sobriety, Benedict Center Sister Program, Clinic J. Zablocki VA Medical Center, Forest Home Health Center, Kosciuszko Sport and Community Center, Rogers Behavioral Health, the West Alex Campus, Wisconsin Community Services, Inc., and right here where we are standing today, Van Baker Recovery Center. Many of these organizations are here with us today, so I want to say thank you to each and every one of you for joining us in the fight. It takes a collaborative, community-focused approach to create lasting, positive change. I am grateful to everyone who is partnering with us to build a stronger, a healthier community. And that's together we can do that. Now, I would like to introduce Milwaukee County's Health Policy Advisor, Dr. Ben Weston.
Good morning.
Good morning.
Thank you, Director LeGrant McLean. And thank you to the Vin Baker Recovery Center, not just for hosting us today, but for hosting one of our newest harm reduction vending machines. Now, this and 7 other locations were carefully chosen to maximize the impact of these machines and the critical supplies that they contain. And the selection was informed by the EVE model developed right here in Milwaukee County during the pandemic for the equitable distribution of resources. In this case, getting these supplies into the areas where they will do the most good. The response has been incredible, with over 17,000 harm reduction items distributed from our vending machines. And as a reminder, these machines contain free, accessible harm reduction supplies. Supplies that can save a life by preventing or reversing an overdose or firearm injury. Naloxone nasal spray, medication storage bags, drug disposal kits, gun locks, and one new additional item, combined fentanyl xylazine test strips. So why these fentanyl and xylazine test strips? To understand that addition, we need to look a bit at the trends that we've been seeing in overdoses in our county. 2023 saw a slight but welcome decline in overdose deaths when compared to 2022, down about 4%. But this still means that in 2023, we saw someone dying from an overdose still every 16 hours. But nonetheless, a small step in the right direction. And so far in 2024, we continue to see opioid overdose deaths with an incredibly high level of fentanyl. 94% of opioid overdose deaths so far in 2024 have included the drug fentanyl, a synthetic opioid 100 times stronger than morphine. And at the same time, we're seeing a substantial rise in the contribution of xylazine, part of a record nearly 30% of overdose deaths so far this year in the county. And as a reminder, xylazine is an animal tranquilizer that causes sedation, it decreases breathing, and it can lead to death. Now, one of the challenges with xylazine is that it is not affected by the naloxone nasal spray. So while you may be able to reverse the fentanyl contributor to overdose, you cannot affect that xylazine component. And this is where that combined fentanyl-xylazine test strip comes into play and is so important. This allows individuals with substance use disorder to better understand what they are using before they do that. And data with fentanyl test strips shows that these strips are effective. Not only do individuals use them, but they change their behavior as a result of that use. They change the amount of drug they use with a partner, or they don't even use at all. And with fentanyl in so many different drugs now, people often think they're taking one drug, like cocaine, for example, only to find out that it also contains deadly amounts of fentanyl. So these fentanyl xylazine test strips are only available thanks to legislative action in Wisconsin to make them legal, signed by Governor Evers in March of this year. And these new and novel test strips certainly will save lives in Milwaukee County. And these vending machines will save lives as well. It's too early to tell definitively, but we are seeing signs of a possible further decline so far in 2024. And we can certainly be hopeful, but hope is not enough. We must keep working as a community, both upstream and downstream, to prevent overdoses from opioids. Upstream, we are investing in housing, in transportation, in mental health services, advocating for healthcare access and education. And downstream, we are working to prevent deaths from overdose. Every overdose prevented from these testing strips, every death prevented from naloxone nasal spray, every patient started on medication-assisted treatment and connected to resources by our fire departments is one step closer to recovery. But we must work as a community. If you own or operate a place of business, have naloxone nasal spray available. Or better yet, get one of these vending machines to prevent overdoses in our community. Together, we will see improvements in our overdose rate in the county. We will see less deaths, and we will see improved health, and investments like this will make that happen. So thank you for your time, and I will hand it to Jeremy Triblett, the Prevention Integration Manager, Program Manager at the Department of Health and Human Services. Thank you.
Thank you. Thank you. Thank you all for being here. This is a really exciting day for me, particularly because for me, substance use has been in my family early on. I was born 3 months early, and when I was born, the doctor looked at my mother and told her that I wouldn't live through the night. And back in those days, a lot of times we weren't having conversations about things like postpartum depression. And so as she began to go through postpartum depression, she told me that she began to use substances for the first 3 years of my life. Those first 3 years of my life had brought me into different systems inside of the county and in different relatives' homes inside of the community. Why do I tell you that story? Because today my mother has recovered. She's accessed programs like Vin Baker and Maida House, and she has begun to turn her life around, and she has been excelling. But the tools and tips that she got, the resources that they gave her, she gave to me. The work that we're doing is not simply putting out vending machines and locations. The work that we're doing is generational. Our goal is that the numbers that Dr. Weston talked about don't exist when my 2-year-old son gets into high school. And so as someone helped my mother, I get to stand here today proudly saying, because of her journey, I didn't use substances, and because of the community support, I can help somebody else do the same. And so we're calling not just for folks to understand that there are vending machines, but we're calling community to go up, step up, and walk up to a vending machine. We want folks to come out of their houses, stop off when they're on their way to lunch, even when they're getting off of work, and go to a location, one of 19, to find supplies that could potentially save a life. We know from the overdose dashboard that there are a lot of overdoses happening in residential spaces. What does that mean? It means that there are some children who witness their fathers or mothers overdosing in their homes. It means there are cousins and aunties who are remembering those moments, those life-threatening and sometimes life-ending moments. All of us need to grieve. All of us need to heal, and all of us need to access harm reduction supplies that can help save a life. And so I want to introduce you all, or reintroduce you all, to some of the components that are happening here today. The first thing is we've created a website. That's a win for us, harmreductionmke.org. On that particular website, you're going to see resources that can empower folks to help others save a life. The first thing you're going to see is demonstration videos for all of these supplies. Demonstration videos done by community leaders. It signals to our residents that this is not a scary conversation. This is not something that we should avoid talking about at kitchen tables or when we're waiting in line at stores. This is something that is now normalized. We've got community leaders demonstrating how to use all the supplies in the machine. Those demonstration videos can be found on that website, harmreductionmke.org. Additionally, for every supply that's in the machine, you can download an instruction manual to your computer or your phone, and you can have those instructions to read, and you can have the videos to watch if you need to. And lastly, when you walk up to the machines in each of these buildings, you're going to see two things. You're going to see a large poster with a QR code that tells you where to find the instructions for the video, and you're going to see these brand new harm reduction vending machine booklets that allow you to read about and further understand how to use the supplies in the machines. By the end of this week, all of the machines will have those posters. By the end of this week, all of those machines will have these booklets. And by the end of this week, you could be walking into your neighborhood and you can be going to a vending machine that allows you to help save a life. Thank you.
Thank you, Jeremy. Hello, my name is Paulita Payton Murphy, and I'm the Executive Director here at Van Baker Recovery. So we thought about why would we have applied for this vending machine? One of the biggest reasons is that being here at Van Baker, we're in what we would consider a treatment desert. So there aren't many providers that are, one, in the area, and then two, that actually have vending machines. So we were excited, one, to apply, and then two, to have been selected. So again, thank you. One of the important things that we look at is the communication with our partners. We can't do this by ourselves. There's no possible way one single agency or clinic could look at the epidemic that's happening. So we need partners, and we thought, why not we join with Milwaukee County and with the other agencies here in the city to make sure that we're able to get the care that we need, not only to our patients that are here enrolled in the clinic, but to everyone in the community that can walk in this lobby and get whatever they need to share with their family and friends as needed. Our mission here at Van Baker is to treat, educate, and to motivate individuals impacted by substance use with the continuum of care that empowers individuals, families, and the communities within this community as well as surrounding communities. So we take this seriously. We truly have a vested interest in ensuring that the people of this community are being served. So we acknowledge and we thank Milwaukee County and all the other entities that had a role to play in us being selected, but also we are honored to be partnering with all of the other agencies so that we can see what we can do to put our little stamp on this epidemic. Thank you.
Hi, I'm Vin Baker. Good morning, everyone, and good afternoon. So grateful for you guys being here today. Every time you guys are here in this facility, it's an opportunity to reach out to those people that don't know we're here, and we're here for help and for hope. I'm standing up here with this opportunity to talk to you guys with this facility because I'm a patient. I've been through substance abuse, well documented, and by the grace of God and great help and great treatment, I'm here today standing 15 years sober with the opportunity to pay it forward and give it back. So we're grateful to have our harm reduction vending machine here, being one of the few facilities selected. It takes a community, and we have to be intentional. One thing about going through sobriety and getting sober is you have to be intentional about getting sober, and on so many levels. This is showing that the community, our leadership in our community are intentional about getting people healthy and sober, and that's what we're here for at Vin Baker Recovery. Thank you guys so much for being here today. I'm excited about the future of this building, this community, this city, this state. We're gonna save a lot of lives, and I'm pumped up about it, and more pumped. I probably shouldn't say this for work, but this is the truth. I'm more pumped about this than I am about Bucks winning a championship. It's a close second though, right? But we're excited here at Vin Baker Recovery. We have a great facility. We have great, wonderful people working here. We have a wonderful team, and we're gonna save a lot of lives. And it takes it one day at a time. It takes one day at a time, but we need help from everyone in the community. We have to have love, support. We have to have machines. We have to have people who support us throughout the community. So thank you guys for being here. It's important to us. It's important to Vin Baker Recovery. Keep coming, because this doesn't stop today. We have to continue showing the support, continue showing the love, and that we're here to make people better. Right, Dr. Woods?
Thank you. We're happy to take any questions. Yeah,
So
please.
I have one question, just because a lot of the items within these vending machines are about gun protection, they're about preventing drug overdoses. There was recently an allergy spray that was a nasal spray as an alternative to EpiPens for people who might go into anaphylactic shock. What additional products you might see in future iterations of these vending machines that might be placed?
Yeah, it's a great question, and Jeremy may have thoughts on it too. I think, I'll just say real quick, I think that, you know, the focus obviously has been on opioids, but as you mentioned, there's gun locks in them too, right? So it's not just about opioids. It's also about preventing, especially suicide-based deaths is one of the main things that gun locks really do by preventing that easy access to firearms. But I think as we go forward, you know, we're open to thinking about different things. What other harm prevention is there? It's not only opioids. There might be new tools. You see the xylazine fentanyl combination test strips in there. That sort of flexibility to adapt to the changing environment that we have related to overdose. But I think there's opportunity for other things as well.
Yeah, thank you. We've had a lot of conversation about what should be added and what should be changed. At this point in time, our goal is to really make an impact where we began, right? Making sure that that overdoses can be lowered and that we make an impact in that regard. That being said, when we think about suicide prevention, the top 3 ways in which people are dying by suicide are from suffocation, guns, and or medication. And so those 2 things are really interconnected. We're also thinking this year of also putting condoms in the machine. When we think about reducing the spread of HIV or hepatitis, we want to make sure folks have that access as well. So we're always innovating, to what Dr. Weston said, but we want to make sure we innovate in a way that allows us to meet the main goal and innovate toward evolving trends as well.
So that 17,000 was items since the first machines were put in?
Yeah, 17,000 since last year when we were all together. And so that's a year's worth of time. I think that speaks to each agency that has been selected. It also speaks to a lot of the residents who are deciding to take action. And so this is the conversation, if you will, is evolving. At first we were talking about what does it look like to have a harm reduction vending machine? Would anybody vandalize them? And we were saying, no, we're not worried about that. And I think this last year has proven that we've got greater goals, right? We don't have to worry about things like that. We can actually start thinking more creatively, and partnering across Milwaukee County in different departments has really allowed us to do just that.
For Director McLean, you know, these vending machines is like a second rollout, so to speak. You've already had 11. What is the feedback that you've gotten so far, and what are people hoping with the next, you know, with these and future iterations?
Yeah, I think Jeremy probably be able to speak best to that, but the things that I've heard is just all positive. Everyone is really excited about partnering and doing this work together. I think, as Paulina has stated earlier, no one entity can have an impact on their own. It will take each and every one of us to join forces so that we can have an impact and decrease the number of deaths that we're seeing with opioid deaths. Any other feedback?
Yeah. We've got great feedback, and I'm not just saying that blanketly. Like, seriously, some of the things that we've noticed is when you place them inside of the buildings, a lot of the staff who would already need access but wouldn't otherwise have it are really being able to say, hey, when I'm meeting with my parents, with my families, when I am counseling folks, they're literally ushering people down as they leave to go and grab some supplies from the machines. That's a huge win. Having readily access in places where you're already looking to get some services met is a win-win for everybody. We've also got stories of people who are helping folks as they overdose in those spaces, right? And so people are running to these machines knowing that they have them. One of the key things that was critical was educating each agency. And so each agency, we designed training videos for those agencies, virtual ones that they had to do and take a test and prove that they actually knew their staff how to use each of these supplies. And so we've taken really great measures to make sure folks have those things. We've also gotten really good feedback just around the educational components from folks. We're looking to take all the educational components in English and put them also in Spanish, and then tailor them toward the demographics that exist around the machines. So if there's a lot of folks who speak Hmong or any other types of languages or have any other predominant backgrounds, we want to make sure we're aiming toward that as well. The last thing I forgot to mention when I was speaking is that we also are going to pilot this year an outdoor machine. It's going to be at Fourth Dimension. And so we're excited because piloting an outdoor machine this year allows us to understand what it looks like to have a machine in Wisconsin's weather, and leverage that for next year as well. So we'll keep that coming, and we'll have more updates just around what it means to have them in different locations and what it means to have them outside.
So then depending on how the outdoor vending machine, what you guys end up seeing, you guys are hoping to also maybe continue to place them in other sections outside, right?
Yeah, so that's a beautiful question. We currently have them in about 4 or 5 different municipalities, right? And so that's stretching across the county in a great way. The second thing is we know that when folks go into a building, they have closer proximity to not only supplies, but also programs and resources that can help them plan their future. So that was very critical for us. In Milwaukee County, we really wanted to prioritize not just reducing the harm as you use substances, but also encouraging you to take advantage of those things that help you plan for your future and meet your basic needs. When it comes to being outside, the key difference here is going to be that it isn't necessarily going to be surrounded by folks who can help meet your basic needs. This is why we wanted to start with we're at Vin Baker. This is why we wanted to start with Fourth Dimension, because they have a really robust community engagement strategy. They're always outside helping folks, and so it really fit well. And once again, we'll learn more about what that means. We're partnering with them to make sure they can get their machine and make sure that they have the capacity to make sure folks are using it well. So we'll have more updates on that in the next couple of months. Any other questions?
Thank you, guys. Thank you. Thank you. Great job, everyone. Great job. Thank you so much for your partnership. Thank you so much. I appreciate you.